Welcome to this explainer. Today, we're diving straight into the fascinating science behind Condrotide. We're looking at a truly revolutionary joint therapy that's completely challenging the traditional standard of care for osteoarthritis. If you're plugged into orthopedics, sports medicine, or just love the cutting edge of biological therapies, you know this is going to be incredibly eye-opening. For years, we've treated osteoarthritic joint pain by essentially adding oil to a rusty engine, right? We just inject a lubricant to stop the grinding. But today, we've got to ask a much bigger question. What if joint therapy could do more than just lubricate? What if we could actually hand the joint the exact raw biological materials it needs to help its own microenvironment recover?
So here's the game plan for this explainer. We'll start with the limits of current therapies, explore the HPT extraction process, dig into the power of polynucleotides and how Condrotide works, and then finally we'll look at the clinical data before establishing what could be a brand new standard of care.
All right, let's jump right into section 1, beyond hyaluronic acid.
For the longest time, hyaluronic acid, or HA, has been the absolute go-to viscous supplement for knee osteoarthritis. But if you look at the recent evidence-based guidelines and consensus reports from organizations like OARC, the debate over HA's true long-term clinical value is definitely far from over. Why is that? Well, because HA primarily acts as a simple mechanical lubricant. It greases the joint. And sure, that's helpful. But the medical community is actively searching for something that goes way beyond mere symptom management and simple mechanical cushioning.
And that brings us to section 2, the HPT extraction process.
So the solution here actually comes from a pretty fascinating source. Mastelli developed this incredibly rigorous, scientifically controlled process called high purification technology, or HPT for short. It actually starts with organically grown salmon rainbow trout, specifically their gonads, or milt. This is collected under super strict temperature controls because, as we know, DNA degrades rapidly at room temperature. Then the cells undergo a really gentle lysis, basically a cellular breakdown, to release intact nucleotides. After that, there's extensive filtration to clear out any cellular debris and high-temperature sterilization to absolutely eliminate endotoxins and allergenic proteins. Finally, the whole thing is freeze-dried into a highly stable powder, giving us a Class 3 medical device.
What's super important here is that Mastelli controls a complete closed-loop supply chain. From the certified European fish farm right down to the final extraction and purification, the entire process is completely vertically integrated. This is a huge deal because your standard commercial DNA extraction kits, they only yield microgram quantities and usually rely on really aggressive solvents. The HPT process, on the other hand, yields highly purified active ingredients in massive quantities, safely, all while completely dodging any BSC or TSC risks since it uses an organically farmed fish species.
Let's keep moving. Section 3, the power of polynucleotides.
So what exactly is this active ingredient we get from the HPP process? Well, they're polynucleotides, or PNs. Essentially, these are highly purified DNA fractions of varying chain lengths, and the chemistry here is just beautiful. They possess this hydrophilic polyanionic structure. That means at a normal physiological pH, these molecules carry a negative charge. Because of that negative charge, they act like massive water magnets. They draw in surrounding water molecules to create this profound, beautifully balanced hydration right there in the extracellular matrix.
Moving right along to section 4, how Condrotide works.
The real crux of this is understanding exactly what Condrotide does once it's actually injected into an osteoarthritic joint. It has this incredible dual action mechanism. First up, the immediate biomechanical effect. By binding all that water we just talked about, it forms a 3D gel. This instantly improves the rheology, the flow properties basically, of the synovial fluid, which restores mechanical joint dynamics. But here is the absolute game changer. As those polynucleotides naturally break down, they provide a deeply nourishing trophic microenvironmental shift. They literally release nitrogen bases and nucleotides that act as direct energy substrates and building blocks for the cartilage cells. And if that wasn't enough, they actively scavenge reactive oxygen species, shutting down the oxidative stress that actually drives cartilage degradation in the first place.
Let's dive into the clinical case in section 5, Condrotide versus hyaluronic acid.
When we look at the direct head-to-head clinical data measuring the intake of NSAIDs, anti-inflammatory painkillers, we see a really sharp, immediate divergence. Patients treated with Condrotide experience a significantly faster, much more vigorous drop in their need for painkillers literally right from the start of the trial, especially when you compare it to the standard hyaluronic acid group. And if we zoom out on the timeline, we don't just see a faster initial response. We see a significantly longer lasting reduction in pain medication over time with Condrotide.
Think about why this matters. By drastically cutting down NSAID consumption, you are directly decreasing those notoriously nasty cardiovascular and gastrointestinal risks for the patient. You aren't just treating a bad knee, you're actually protecting the whole patient.
Now you might be wondering, how do we know Condrotide isn't just a slightly better pain masker? Well, look at the in vitro data measuring cell viability and extracellular matrix production. It shows an absolutely incredible shift, specifically looking at type 2 collagen and aggrecan, literally the vital building blocks of healthy cartilage. Cells treated with polynucleotides show a massive, dramatic increase in the production of both of these structural components at the 30-day mark. It is quite literally helping the tissue rebuild itself from the ground up.
But then, in stark contrast, let's look at those exact same metrics for cells treated with hyaluronic acid over that exact same 30-day window. The HA treatment actually resulted in a decrease of those crucial structural cartilage components. So while HA might mechanically lubricate the joint for a little while, this data strongly suggests it just doesn't provide the nourishing, cellular-level support that polynucleotides do. Actually, matrix production drops off. And that brings us perfectly to our final section, a new standard of care.
Let's bring all this amazing data together. Who really needs this therapy? Because Condrotide is totally resorbable and highly tolerated by the body, it's strongly recommended for early-stage OA patients. We're talking grades 1 or 2 on the Kellgren-Lawrence scale. But it's also an absolute game-changer for athletes, both amateur and competitive, who desperately need a rapid return to joint mobility so they can get back to their sports. Plus, for anyone dealing with post-traumatic OA or patients with other comorbidities who really need to avoid the systemic side effects of prolonged NSAIDs or intra-articular corticosteroids, Condrotide just offers a phenomenally effective alternative.
When you put these two therapies side by side, the contrast is literally night and day. While hyaluronic acid gives you basic mechanical lubrication, Condrotin steps up with biomechanical and deep trophic support. HA gives you a slower, moderate drop in painkillers. Condrotin drives a vigorous, much faster reduction. Where HA actually sees a decrease in matrix production over 30 days, Condrotin actively stimulates the increase of type 2 collagen and aggrecan. And at the end of the day, Condrotin just delivers earlier and much longer-lasting pain control.
As we wrap up this explainer, I really want to leave you with this provocative thought. If we now have the biological technology to actually feed the joint, to literally provide the cellular building blocks it needs to thrive, rather than just greasing it with a simple mechanical lubricant, isn't it time we completely rethink osteoarthritis preservation? The clinical evidence is overwhelmingly clear. It's time we elevate our standard of care and finally give our joints exactly what they need to recover. Thank you so much for joining me, and keep questioning the standard.